Foundation. I want to welcome you to our first Conquering COVID Town Hall meeting. We are so glad that you have joined us for this evening's conversation. We want to hear from you in this event so we can continue to improve. So please make sure that you've signed in at the back, at the table at the back, and take a moment to fill out the pre-event survey, and we'll collect those at the end of this evening's session. I want to share my thanks for our volunteers and partners who've helped us make this event run smoothly. The work of the Chris Howell Foundation is made better by these gracious folks volunteering their time and energy. Dominique is going to tell you a little bit more about our partners that have helped us tonight with tonight's town hall happening. And Dominique Bryant Howell is the president and co-founder of the Chris Howell Foundation. Dominique?
Thank you so much, Jenny. Thank you all once again for being here. I would like to take this opportunity to thank some people who have helped us to make this event possible. I would like to acknowledge Council Member Nikki Hunter, who's in the house tonight. Thank you so much for all that you did, the phone calls, the emails. Thank you so much for making tonight possible. Also, I would like to bring up the City of Arlington Fire Department Deputy Chief James will come up. Thank you.
Okay, yeah, welcome. We're just here to partner up with the Chris Howell Foundation. It's our second event to actually work with them with. We're in the back here. We have all 3 vaccines available. We're able to do first, second, and boosters for 12 and up on all 3 medications. And so if you're interested in getting vaccinated tonight, you can go to the back of the room. We'll get you registered and get you done and get you out of here shortly. Yeah.
Thank you so much, Deputy Chief James. It was very important. Our event is called Conquering COVID in the Community, and it was very important to have the City of Arlington Fire Department to partner with us to have the vaccines here tonight. So we're excited about having them here. Next, I'm going to bring up from Numi Health, Jacqueline. They are here also to do testing. We thought it was very important to have testing on site tonight, so people do not have to actually come in to this event area. We have another location set up for testing. So, Jacqueline.
Hi, everybody. My name is Jacqueline Fuller. I'm the Texas Field Operations Director for Nomi Health. And as mentioned, we are offering COVID testing at no cost just over here in this back room. It is a rapid antigen test, so you get your results in about 15 to 20 minutes. We do have stagnant sites throughout Dallas. We have some in Arlington as well, and kind of the suburbs, as well as throughout Texas. So I would highly encourage you all to visit our website, nomihealth.com/Texas, to see where we're at. And thank you all so much for having us, and thank you to the Chris Howell Foundation for having us. We're so excited to be able to partner with them and with the community to give back. Thanks.
Okay, I am going to bring Jenny, our Executive Director, back up at this time.
I just want to take another moment to thank all of our partners. This collaboration is really necessary in order to get these conversations into the community. So thank you for your time, your evening, and your work in these things. Now it's time to introduce you to our host for this evening's discussion. Chris Howell Sr. is CEO and co-founder of the Chris Howell Foundation. Chris is a renowned speaker and broadcaster, and tonight he's our host and moderator for this important conversation. Chris.
All right, all right, all right. How are y'all doing? Oh boy, that was quiet. How are y'all doing? Good. You know what, just before we get started, and again, thank you to all of our partners and thank you all for being here as well. Councilwoman Hunter, did you want to say something to the audience? No. I'm sorry. Let's do this. Pulling an audible here. A guy who knows nothing about football. You want to come up or you want to do it from? Okay, come on up. I'm sorry, guys. We're pulling an audible here. But we, again, like Dominique pointed out, we are so grateful to Councilwoman Hunter. She has been a huge supporter of the Chris Howe Foundation. So we want to just give you an opportunity if you wanted to just say anything or just belch in the mic, whatever you want to do.
I just want to say thank you to the Chris Howe Foundation for being here tonight and having this event in District 3. So thank you guys for being here.
Absolutely. Thank you. Yeah, we understand the importance of partnership. And again, partners like Councilwoman Hunter, the fire department, Nomi Health, again, thank you guys so much for the support. As we get ready to get started tonight, I have the great privilege of talking with two very educated women, women who understand what's going on with this vaccine, what's going on with the mask. So we're going to help get some questions answered. It is an interactive session like we talked about. It's not just a conversation with us, but we want to give you the opportunity to ask questions as well. Is that going to be okay? Are you going to ask questions? All right, good deal. Let me ask you guys to do one other thing before we bring the guest up. Can you pull out your cell phone, particularly for those of you who live in the Arlington area, can you put on Facebook or something of that nature? A very important conversation is about to take place. If they've got a question about a vaccine, if they need a vaccine, if they actually need the booster shot, that's available in the back. You don't see the testing taking place in this room, but that's in another room right next door. There's about 6 people over there that's providing testing, no appointments, no waits. They come in, they will get tested. In and out real quick. Again, it's all available. We can't do anything with, again, we could be here, but we can't make people come. But we wanted to make sure we were in the community, so we want to make sure we don't waste the folks' time. So if you could please help us get that message out over the next hour and a half, I'd greatly appreciate it. All right, with that being said, let's get our conversation underway. Let's bring up first and foremost, Gabby Guerin, if you'll please join me up here on stage. Give her a hand, would you? Welcome, Gabby. And we're going to read her bio in just a moment, and you're going to hear, again, why she's on stage with us here tonight. Also, coming up on stage and joining us here on stage is the one and only Dr. Josephine Thinwa. Please give her a hand as she comes. All right, good deal. Well, ladies, how are y'all doing this evening? Good. Thank you so much for being here. Have you been at the hospital today?
No, not today. The lab, actually.
You were at the lab today. Okay, good deal. All right, so first and foremost, let me do 2 things here. Let me get the bios for you. We're going to first start with Gabby. Gabby Guerin is a native Fort Worthian. She attended Paul Lawrence Dunbar High School, graduated from Texas Southern University with a BS in pharmacy. She's been a community pharmacist for over 24 years, has worked in all aspects of pharmacy, hospital, retail, mail order, long-term care, and hospice care. She's married to Thomas Guerin. She's a mother of 4, grandmother of 1. She's a PTA officer and member, and she's a treasurer of PL Dunbar Alumni Association of Fort Worth. She's a member of the Fort Worth Alumni Chapter of the Delta Sigma Theta sorority. She's also a CASA member, that's Court-Appointed Special Advocate. So again, Gabby, thank you so much for being here.
Thank you.
Absolutely, thank you. Give her a hand. Dr. Josephine Thinwa, MD and Ph.D., is a physician scientist at the University of Southwestern Medical Center in Dallas in the field of infectious diseases. She completed her MD Ph.D. degree in 2015 at UT Health San Antonio and is a double board certified internal medicine and infectious disease physician. Beyond treating patients, her passion as a scientist is to increase our understanding of how the immune system fights viruses. That's very important for us tonight. Dr. Thinwa spends the majority of her time engaged in NIH, that's the National Institute of Health, funded lab research and mentoring programs for the next generation of physicians and scientists. Give her a hand, Dr. Josephine Thinwa. Okay, so I read your bio, gave them all your accolades. Tell them a little bit about who you are as a person.
Oh, thank you for that introduction. I'm like, who's that?
Yeah, I'd like to meet that person.
My heart is to try to reach patients, to try to reach everybody in terms of getting us through any viral infections there is. Actually, work a lot with HIV patients. I appreciate the Chris Howe Foundation, all they do there. And now with COVID, it's really opened up sort of our and my desire to get people, especially people who are Black and brown who look like me, vaccinated to get us through this pandemic, not just from the clinical side of things, but actually to help us fight the future of these viruses, these plagues that keep coming. I don't know if anybody's been keeping track, but in the last 20 years, we've had Zika, Ebola, different types of flu, swine flu. We had SARS virus 20 years ago. These things keep happening, and at some point we have to say, are we gonna actually get ahead of this, or are we gonna always be on the offense, having to shut down schools, having to shut down hospitals to fill them up with patients, or are we actually gonna figure out a way to treat these and have medications that can work from the get-go? So that's what I do, and I'm here to answer any questions from both as a doctor, but also as somebody who spends a lot of time thinking about how we can get ahead of this virus in the future. So whatever questions you have, I'd love to answer them.
Yeah. You know, I'm glad you said that. I'm glad you said you're just as concerned as we are. So again, you're looking to try to help end it just like we are. All right, Gabby, I want to come to you. Talk about who you are as a person.
As a person, I'm a mom, a grandmother, a wife, sister, aunt, and I know that a lot of my family, a lot of my friends, because of what I do as being a pharmacist, they come to me when it comes to things regarding health. So I try to take a simple approach to explain what is actually happening. Because through this entire thing, it's been very hard for me to get people to understand why the vaccine, why now, why so quick. So it's just kind of been my mission to explain that we, in our generation, we've always had the luxury of time, we felt like. In this situation, we did not have the luxury of time. So I was trying to get out to the community that with this, it was what we have are the vaccines, that's what we need to go with. And we do need to address our fears, put them out on the table, but don't let the fears be the main thing that drives your decision.
Absolutely. All right. Well, one of the things we want to do tonight is we want to help to educate, and we feel like if we educate, that, of course, helps to diminish the fears. So tonight we'll be talking about the Omicron variant. We'll also be talking about this new stealth variant, I guess, stealth Omicron. We'll talk about that as well. We're going to talk about the peak. We'll talk about vaccines and boosters. That'll kind of give you an idea how we're going to shape the conversation. But again, any questions that you guys have, please keep those in mind, because what we're going to do in just a moment, we'll grab a mic, we'll put it out in the audience and allow you to ask any questions, burning questions that you may have come in with or that may come about as a result of the conversation that we're having. All right, as we start though, one of the things I wanted to talk about was the fact that when we talk about getting this vaccine and getting things under control with this virus, now I guess only 64%, last check, only 64% of the population is vaccinated, but only 40% of those that have been fully vaccinated or have actually received the booster. So I guess the question becomes, is it realistic to think that we will ever get to a point of at least 80% in terms of being fully vaccinated as a society, when only maybe 50% of the population generally takes the flu shot? We'll start with you, and then definitely want to come back to you with that as well.
No, that's a great question. I mean, it's something we strive for, to get more people vaccinated. I mean, who's willing to raise their hand if they haven't been vaccinated yet? Everybody's been vaccinated, really? Okay,
so we have a fully vaccinated audience. All right.
Wow, fully, both doses?
That's off to you guys.
Wow. What about the booster shot? Who hasn't gotten the booster shot yet? Okay.
I haven't reached that point yet.
Okay, good. And I think that's part of the issue too, is right now the CDC recommends that you get the booster about 5 months after you've gotten the Moderna or the Pfizer shot. Now keep in mind, if you got the Janssen or Johnson & Johnson vaccine, you're supposed to get it after 2 months, because what we know is that shot, even though it worked really well for some of the previous strains like Delta and Alpha and all the other strains we had before that, it doesn't work as well for the Omicron. So honestly, if I were you, I'd just go ahead and get the booster if you've had the Johnson & Johnson one shot. Okay. Now, so that is part of the issue, is that there is that lag in time. And the other thing that I'm noticing too is Moderna just released information that they're already working on the booster for the Omicron. So we kind of almost feel like we're not quite, like we get one booster only for the next one to be coming out. So how do we get caught up? But the only thing I would say is that, to me, the numbers can become maybe even a little discouraging, as you put it. But to me, is we just do what we can in terms of when it's time for you to get your shot. If you're 5 months after getting your last Moderna or Pfizer shot, or if you're already up for your next booster, just go ahead and get it scheduled. Don't look at the numbers. I think each person, if each of us do what we can, talk to our family members. Like my mother-in-law, God forgive me for talking about her, but she's very Republican to the core, and along with that, not to say anything about not to bring politics into any of this, she didn't want to get vaccinated, and I worked on her. I used any and every single bribe I could. Like, you're not going to get to come visit our house if you don't get vaccinated. You're not going to get to do this. She lives in San Antonio. But she's a wonderful lady. I love her. And she got vaccinated after talking to her and explaining to her. And I think since a lot of us here have been vaccinated, it's our job to get to that 80%. Yeah. It's our job to talk to our family. Don't give up on your family members. Don't give up on your friends. All of us know somebody who hasn't gotten vaccinated yet or who's forgot their second shot. It's not too late. So I choose not to get discouraged by the numbers. Okay. When the next booster comes, I'm going to jump at it and get it. But this is an evolving thing. So we're going to keep just trying to keep ahead of it and keep getting the next shot that they say we need to get.
Okay. And I want you to be comfortable. You pull that mic closer to you to where you're comfortable with it. But you raise a very good point. You talk about the waiting period. And Gabby, I want to come to you. As a pharmacist, I mean, of course, you have to abide by the CDC guidelines as well. But now, like she just pointed out, there may be a possibility for those who had the Johnson & Johnson to come to your facility or any pharmacy to get the booster. Talk about that process and what that is like.
Yes, absolutely.
And same thing, pull your mic just a little bit closer to you.
What we see is that when the numbers go up for COVID, or when people want to go somewhere, or the holidays come in, we have an influx of people wanting to get, if it's their second shot or their third shot, either or. They come in influx. Mm-hmm. I am not boosted, only because the day that I went to go get boosted, I found that I was COVID positive. But it did take me a long time because I consider myself part of the public. Mm-hmm. So I have the same fears as everybody else. Just because I'm a pharmacist, it doesn't take away the fact that I'm scared of needles, that I'm really distrustful of certain medical, things. So I have to, but I'm also able to look at my fears and face them with knowledge. And so that's what I had to do. So it took me a long minute to even want to get boosted, because I'm like, by the time it's time to get boosted, y'all gonna say it's time to start round 2. So what's the point, And because we don't know where we are in this. But when I look at the numbers and I look at all the data, getting boosted is the right thing to do, just like it was the right thing to do when I first got it done. Yeah. I didn't get it when it was first available at the end of 2020 when it came to our pharmacy, which we all had access to it. I was like, oh, I'm not quite sure, but it was all fear. It was all fear because we have never used mRNA viruses, vaccines before. Mm-hmm. It was all new, so I was scared just like everybody else. But once I got over the fear and I got it, and I got the shot, I shared with my family and my reasons why. It may not have been enough for some of them, but I think that once we make up our mind that we're going to do it, that we share it with other people, because that then gives them the power to say, okay, well, she's here, so she didn't die. And she's pretty much, I go to her for everything else. I trust her. She's smart. She's honest. That's how people view me. So when I did that, I know it did, because I got messages of people saying, you know what, you really make a good point. I'm scared too, but I'm more scared of this virus, and I got to do my part. And that's the whole thing. I just want everybody to understand that we all have to do our part, and getting vaccinated is part of doing our part.
Absolutely. Yeah, and you guys being here tonight to receive this education and information that you can go back and share in the community is you doing your part. So again, thank you for that. As we get into the Omicron, again, that's the most pressing and biggest issue right now. When we talk about Omicron, I guess and maybe we have come to a little bit of an understanding of what makes this variant different than the others?
Yeah, so Omicron, as some of you may already know, it originated in South Africa. And the thing that was most noted over there, and South Africa was great by sharing a lot of the information ahead of time before it actually even got here, so we already knew what to expect, is that a lot of the older strains, including Delta, the one that was in the summer last year, kind of rev up like this. You know, you see cases going up slowly, and all of us start wearing masks again and doing all the things we should be doing. But Omicron, on the other hand, within 2 weeks, it basically shoots up almost straight up. And that was the case in every single country that it hit. Now, it turned out that it's actually one of the most infectious viruses that we've seen in modern history, meaning that majority of Americans, whether you know it or not, have already gotten it. And I'll say that again, you probably have already gotten it. You may have been asymptomatic, or maybe you thought you had allergies, but you actually got it. But the thing about it, though, that was also really different, especially unlike Delta that we just finished last year, is that it was a little bit milder, especially if you're vaccinated. And I want to say that really carefully, though, because I don't want people to go out there and say, oh, yeah, Omicron is nothing, it's just mild. So for people who are vaccinated, especially if you're boosted or you've recently been vaccinated, you're still within that period of 5 months after your last shot. And again, this is Pfizer and Moderna I'm talking about. We noticed that it was milder, 3 times less likely to land you in the hospital. And the vaccines actually still worked really well in preventing people ending up in the hospital. And so that was great, but the problem with Omicron is that it's so contagious and so many people have gotten it. We're talking about, like, at some point in the US, almost 1 million people a day. 1 million people a day. I forget what the population of Dallas proper is, but I think it's not that much more than 1 million, maybe 1.5 million. And that's the people who we know about. So not the people who are doing the home tests and everything else. It's a lot of people getting sick a day. So the hospital's still filled up, right? So it's not, some people are like, have been saying, oh, it's just like the flu, or it's just like a cold. It may be for people who are vaccinated, but keep in mind, the flu doesn't cause 1 million cases almost a day. So the hospitals have never, in my lifetime, in most people who've been practicing medicine for even 50 years in their lifetime, has never filled up the hospitals. So the hospitals are full. We have about 4,000 people in the hospital right now in the DFW area. That's a lot. And so yes, milder, very contagious, and if you're not vaccinated, it's definitely not milder. I'll tell this one last little story before I hand it back over to you, Chris, but I had one of, we're getting a little bit work done on our house, and our contractor, you know, he came and he's a guy who doesn't believe in getting vaccinated. He was like, so we were calling him to come do work, and it's been already 3 weeks. He hasn't showed up. Finally, he shows up, and we're like, hey, Ryan, what happened? He's like, oh, I got COVID. It's like, oh, how did it go? He's like, oh, well, it wasn't that bad. I don't know why everybody's making such a big fuss about it. I was like, really? He's like, yeah, no, I survived. He's 50 years old. So I said, what happened? He said, well, you know, I'm not vaccinated, and I was down. I couldn't get out of bed for 2 weeks. I was like, okay. It's like, and I couldn't taste anything, so I lost 22 pounds. I was like, okay. And he's like, I'm still having a hard time getting out of bed 3 weeks later, but I'm able to get up now and get back to work. I'm like, okay. So he lost basically almost 3 weeks of work, lost 22 pounds, and that's not a big deal. So again, if you're not vaccinated, don't listen to what people say out there. It's no joke. And so do it for yourself, but do it for somebody else in case you catch it and somebody else, you hand it over to somebody else. So that's my 2 cents on Omicron.
No, and I like it. And I'm glad you were careful when you say that it's mild, because I think one of the most prominent cases that we've seen of late, this gentleman is vaccinated and boosted, Stephen A. Smith. Talked about the fact that he's vaccinated and boosted, got Omicron, ended up in the hospital for a couple of weeks. So again, when we say that it's mild, I think, again, we have to think about that in a relative term. Right. It could very well be that you could be that percentage that, you know, again, that it affects in a very, you know, non-mild way. Exactly. But that's why we talk about mask and the importance of mask. Yes. So when we come in, that's why we're sitting so far apart and feel like we're yelling at each other across the room. But we want to be safe. So when we talk about Omicron, and then we're hearing the news as of late from the CDC, as it relates to what I thought was a pretty decent mask, that this may not be as sufficient. Talk about the importance of mask and what you understand the differences to be.
The importance of mask there are so many good illustrations on YouTube that explain, even if you just wear a cloth mask or just the regular blue mask, you decrease your chance of infection so low if you didn't have anything.
Yeah.
So it's almost like if somebody was throwing mud in here and I did this, well, I'm gonna get some, but I'm not gonna get, a lot.
Right.
But if I had a big old shield and they threw it, I wouldn't get anything.
You're fully protected. Yeah.
So it's something better than nothing, because you're not just you're protecting yourself against them, but also protecting them against you. So if both of us are wearing masks, we decrease the chance of spreading it so low just by doing the mask thing alone.
Yeah.
The thing with these is that, in our society, we have fake everything. People are literally making fake N95s. And I just think that is totally ridiculous. Your N95 should be an N95, period. They shouldn't be able to sell a fake N95, because it should do what it's supposed to do. It should be protecting against those really small particles, and you should be able to have confidence. But the thing is, it's just even like drugs. Some drugs, we have fake drugs on the market. It's almost like they can't stop it. So I don't think it's not like it's not the actual N95s that's not working. I think it's that people aren't buying N95s. They don't want to. They're just wearing regular masks. So that's, I think, is more of not being compliant with what we're told to.
Pull your mic around to you.
Not being compliant with what we're told to do, rather than this actually not working.
Okay.
And I just want to say about Omicron. We found out early with my daughter in March of 2020 that right before they went to spring break, and remember, they never went to school after spring break. She got sick that Friday, and we went to Care Now. They tested her for everything: strep, flu A, flu B, everything. She didn't have anything. So finally the doctor said, I don't know what this is, but we're gonna treat her like she has the flu, a viral flu. Okay, find out that's that. From that point until December of 2021, we were fine. I absolutely kept my family safe. Now, I'm a sanitizing nut. You're going to wear this mask, and we're not going anywhere. So I'm following everything that we're supposed to do. December 24th, Christmas Eve, I tested positive, and it was Omicron. Because Omicron is like Usain Bolt. It just goes everywhere, and it's so quick, and the onset is so quick that it was nothing like Delta. Delta was, to me, more virulent. It caused more problems, but Omicron is just, it's almost like you can't not say you're gonna get it. It's almost like everybody's gonna get it at some point. So, but I'm glad it's considered milder, but it's really not, because one thing I learned is that what's considered mild in some instances is that you didn't have to get assisted breathing. You didn't have to get on a ventilator. Okay. That's considered mild. That's not considered mild to me. Yeah. That's kind of serious if that's where I am. And then you also got to look at the burden on the hospitals. So it's just not that they have COVID patients, but they can't take anybody else. So if you're in a car wreck, or if you need something done right then, like an emergency surgery, you don't get it done because they don't have the, So it's not just the COVID that is the problem. It's the spillage. And then since Omicron is so quick to spread, then now the nurses are getting it, the doctors are getting it, the janitors are getting it, so these people aren't at work. So who's cooking? Who's cleaning up? Who's doing? Yeah, so it just has a bigger, broad effect rather than just you have COVID. It's just bigger than what people think, and they don't look at the bigger picture.
Okay. So, Doctor, to come back then, we came tonight to try to help to educate and prepare people. So, as she pointed out, it's extremely contagious. What do? We're wearing our masks, we're washing our hands. Are there any additional steps that we need to take? And now, not just Omicron, but now we're talking about this stealth Omicron. So is it even more contagious? And I know that we just announced that today and then yesterday. So I guess, have we done an assessment to determine where we're going to be with that?
Yeah, and for anybody who's wondering what's this stealth Omicron about, so there looks like in Denmark, there's now what they're calling a sub-variant, meaning that, all these variants are almost like branches off a tree. Now there's another little branch that's come off the Omicron branch, and they don't know yet exactly how contagious it is. Some reports say that it may be 1.5 times, so maybe just 50% more contagious than the current Omicron, which is a little bit scary because
Right.
Omicron is already quite contagious. But honestly, it's too early to tell. It may or may not end up being anything. Now, keep in mind, these mutations of these, or the changes that happen with these viruses, happen all the time. It's not something that's special with SARS-CoV-2 virus. That's the virus that causes COVID-19. It's not something special. It's what happens with the flu. That's why we need a flu shot every season. It's because the flu virus changes itself every season, and then the vaccine that we got the season before doesn't work anymore. So this is common. This is not news to anybody who works with these viruses. Now, the issue, though, is that unlike for the flu vaccine, we're not able to predict. We've come up with ways of predicting what the next flu season is going to look like. That's why there's a vaccine ready before the flu season starts. We're not quite there yet. But I will say, though, to your question, my belief is if we could get all vaccinated, as much as we can approach that 100% as possible. Obviously, we don't have vaccines for kids under the age of 5 yet. So 5 and up, if we could get vaccinated, I do think we can go back to living life as normal as possible. Because I think that's what a lot of people are asking is, when are we ever going to go back to normal? Honestly, does anybody remember what normal looked like? Like, what was life before February 2020, I think? It's hard to remember, right? Like,
Yeah.
it's hard to even not wear a mask. It's hard to think about when we used to go to restaurants and make a trip and expect that it's not going to get canceled, or my husband traveled the other day and he went to New York for something, and next thing you know, he's calling me panicked. He's supposed to go to this restaurant and he didn't have his vaccine card with him, and they're not letting him in. He's like, "Can you please get this for me?" And I had to leave work, go take a picture of it. And so when is life going to get back to normal? And I do believe as we all get vaccinated and people also get infected, our immune system is actually going to get to a point where this is no longer the novel, meaning a new coronavirus, but actually our immune system gets used to it. Keep in mind, these coronaviruses have been in circulation for a long time. You've had one before. It's what causes a common cold. It's one of the viruses that causes a common cold. So the problem is, a lot of us, if you think back, let's say March 2020, with everything shutting down, all of us are really scared. We thought if a vaccine comes out, it's going to eradicate COVID. Didn't we all think that? Oh, okay, I'm waiting for the vaccine and then all this will be over. Well, that was wrong. That was wrong. They didn't tell us the right information. All the vaccines were meant to do was to turn COVID from the scary boogeyman keeping us home, keeping us locked down with masks in our houses, to a common cold. And, you got Omicron. I don't know your experience with it. Actually, my husband and I got Omicron January 1st, and it was actually not the worst cold I ever had. It was, thanks to God, and I am boosted, but it really wasn't. Actually, I was happy because the UT Southwestern makes you stay home for 10 days. I wrote an entire paper during that time. I guess I can work, from home. But so it was like a common cold for me, thank God. But that's what our goal is, to get to a place where this becomes like all the other coronaviruses that we've had for centuries, just another common cold. So I think if we change our thinking to that, I think it helps. It makes it less scary. It makes it where we realize the vaccines are actually working, because some people are like, oh, the vaccines are not working. I know a bunch of people like Gabby and I who have gotten COVID. Well, yeah, but it was a cold, and we're here to talk to you about it a couple of weeks later. I didn't miss 2 weeks of work and cannot get up in the morning. So that's the goal. So I really think vaccines is really, now I'll add one other thing that's actually really important. The other thing that gives me hope beyond vaccines, there are 2 drugs that are on the horizon. They're already FDA approved for emergency use. One's called Paxlovid by Pfizer, and it's basically Tamiflu. Has anybody ever had Tamiflu before? It's basically like Tamiflu. Actually works better than Tamiflu. Keeps people out of the hospital even if they're not vaccinated, if they get COVID. So that gives, and it's a pill. So if you could get a prescription for this drug, you're gonna not end up in the hospital, and it works like 90% of the time. So So that drug, it's not widely available right now, but it is coming. And then another one that's an injectable called sotrovimab. So that's another one that keeps people out of the hospital. So between those drugs that can help people who are unvaccinated, and then the vaccines for those who are actually willing to get vaccinated, hopefully everybody, I think we're actually going to get past this. I'm really optimistic.
Okay. I guess I'll challenge you in the getting back to normal. Because even if we're vaccinated, like we've just stated, folks who are vaccinated still get Omicron. Do you really think it's realistic to think that we'll get to a point of quote unquote normalcy or back to normal, what we did pre-COVID, if in fact, again, everyone can still contract the virus and it shuts you down for a couple of days? Even with everyone being shut down for a couple of days, it interrupts workspaces, things of that nature. So I think, will we ever really see that even with everyone being vaccinated?
It's hard to say. It's hard to say. This virus has been smarter than most of us. And it's hard to say what the next variant looks like, right? Some of us are clinging on to the hope that Omicron, however scary it is, has proven that the vaccine still works. Because the changes that we see in Omicron are really significant changes. It's such a different virus from the one that came from Wuhan, China, that I almost liken it to like saying Tyler Perry is the same person as Medea. I'm not sure. It's the same person inside, but looks really different on the outside. I don't know. But it is, and yet the vaccine still works. So I do think at some point, we'll get ahead of this in terms of, now, whether we keep wearing masks and being conscious, whether we're a little bit better about I have a little fever today, let me not go to work and tell everybody, oh, stay away from me, I'm gonna sneeze into my sleep, and actually stay home for a couple of days, do the things that we should have been doing when we got the flu and didn't go ahead and give it to everybody at work. I think some of these practices, I think I may keep wearing a mask once in a while. I think it's still smart to do some of these things, but not be where we're quarantining for 10 days or, you know what I mean? Where it's really excessive disruption to society, or we're filling up the hospitals with patients and not able to do anything else like Gabby talked about.
So Gabby, I want to come to you. You've actually had Omicron. We want to get into this whole infectious period. How long is it when you, I guess, at the most infectious?
Okay.
We'll start with you and then we'll come to the doctor with that question.
I was the most infectious on days 2, 3, and 4.
Okay.
And I can honestly say the worst thing was my fear, because I'm thinking, Lord, is it gonna change and I'm gonna die? Because when you're sick, you take all your clinical knowledge goes out the door. You can't treat yourself. Yeah. So the worst thing I had was that I had a sore throat. But generally, you have a sore throat, you can take a lozenge, and it's up here, you can get rid of it. Well, my sore throat was right here. Right before it branched into my lungs, I could get nothing down there. I couldn't swallow my own saliva. I couldn't drink water. Gatorade burned like I had put a fire in my throat.
Pull your mic. I'm sorry.
Okay.
Stay in that mic for me. That way they can fully hear you and we can get it on tape as well.
And Gatorade actually burned, and that occurred for about 36 hours. And I had chills, body aches, and I was just fatigued. I felt like an old dish rag. I just didn't have the strength to do anything. And that's what, to me, the fatigue was the worst part, because after I got the symptoms under control, my throat stopped hurting, I could still eat. I literally, certain days, I just couldn't do anything. I only had the ability to open my eyes, go to the bathroom, and go back lay down. And I did that for, 8 of the 14 days.
Okay. 8 of the 14 days.
8 of the 14 days, the fatigue was
And this is
terrible.
Omicron.
This is Omicron.
Yeah.
So it started out like a flu, because I had gone to Houston, and I thought that whenever I go to Houston, which I went to school there, is I get these allergies. My eyes start watering, and it always happens. I get a cough. That's what I thought it was. Well, that wasn't what it was, because the next day I tested positive. So it was like, I guess you could say a flu, but it wasn't a regular flu, because I've had the flu before, and I could just sit in the bed, drink whatever, soup, and I'll be fine. I didn't feel like that, because then my throat started feeling like it wanted. It was just, I don't know if it was more the fear or what it was, but it was just different. So when people say it was like the flu, it wasn't like the flu for me. And then I don't know, it could have been, because like I said, I was going to get my booster that day at my job, and they said, let us test you first, because we've had some cases, and I tested positive. So that happened. One thing I wanted to say is that people hear what they want to hear when it comes to medical knowledge. They never said that the vaccines were going to cure anything. I've gone through all of the news reports. They never said that. That's what we wanted to hear because we wanted to get back to our lives. They never said that. That's one thing I put in my post when I got vaccinated is I knew that I was getting that vaccine the vaccine was going to keep me from staying in the hospital and I would not die. That was my understanding. So I think people have to really, you got to take the fear out of what you hear and listen to what they're actually saying. Because they never said that, but that was the understanding. Because I asked the question, and that was their honest. They were like, yeah, we thought this was going to eradicate. It was going to be gone. We get this and we be done. I was like, but they never said that, y'all. You know. Also, I think that the politicization of the thing, it makes me so angry because that is such a non-factor in getting us to where we want to be, but it has played such a huge part, you know. And like, well, here's one example. Pfizer is, you know, they making this virus too quick and da-da-da-da-da, but you're calling for Plaxavid. Who you think makes Plaxavid? Pfizer. That's who makes it. But that's okay because it's a pill. So just say you're scared of needles, you know. Yeah. I'm just saying, but people, it becomes this irrational thing in our minds. You know, it's an injection. Oh, it's bad, but it's a pill. I can go to the Maze concert. Okay, I'll take it. You know, that's kind of how people feel about it.
Right.
Also, I don't know if I want to go back to normal because I don't really think that it's normal that you think that you should be able to touch a grocery cart and you don't think, and it's just perfectly clean, there's nothing on it. No, that was never logical. It's never logical. They should have always been wiping down the baskets. They should have always been wiping down the, you know, or if they're not doing it, you do it. So to me, it just kind of showed us how we had gotten so lackadaisical with our lives and our health. You know, we should not go back to where we're not taking vitamins and changing our diet, turmeric. You know, we shouldn't go back to that. We should always be our first defense is us, you know, and I think that's one thing that it has helped is to show that there are some things we can do to help ourselves if you don't want to get the injection, but at least have your convictions line up with your actions. If you don't want to get vaccinated, don't gather, wear your mask, and sanitize. You got to do those. You can't just, you know.
At the very least. Yeah.
But that's a lot of things. People want to go back to normal, but they don't want to do the things that it's going to take to get us back to what they consider normal.
Yeah, I think we certainly have a new normal now.
Right.
We have to get used to it. Talking about normal and gathering, things of that nature, when we start doing the reports that we have reached the peak, what are your concerns when it comes to announcing things like that? Do you feel like when we say, okay, we reached the peak now, numbers are starting to come down, hospitalizations I guess what happens when you reach the peak, at least in latest reports, is the hospitalizations go down, but the deaths are increasing. That's kind of an odd thing. Explain why that is and what your concerns are maybe when we talk about reaching the peak.
Yeah, no, that's a great question. So the peak, basically, as I said, the Omicron shot all the way up. At some point, you wonder, are we going to actually start coming back down? And sometimes when it shoots up like that, you do have a decline. Other times you have what they call a plateau, where the cases just stay the same number for a while before they start coming back down. Now, one thing I'll say, though, is a lot of times we've noted is that the incline, like how quickly the cases go up, is a lot faster than how quickly they come back down, meaning that the downward it trails off a lot, meaning that a lot of people get infected. Maybe it's because people start saying, oh, well, we reached the peak, cases are coming down, let me stop wearing masks. And so we see a huge kind of trail of people getting sick, and hospitalizations still keep going for a while. So I am happy. We've seemed to have started seeing some signs of hope that at least the cases are going down in different places in the country. But the hospitalizations always lag behind the case numbers. So that's why you may still see the hospitalizations may not come down as quickly as maybe the cases do. And then deaths lag a lot further out, because people tend to die from being on the ventilator for a long time, and finally the person they don't regain their lung function. So that could take, with COVID, some of it has taken weeks, people on ventilators. So the deaths can lag on for a while. So, so we'll have to see how long this takes. Some of the modeling groups here in UT Southwestern are saying somewhere around end of February to March, we may see kind of the tail end of this, but the model's a model, it's just a prediction. So I think it really still depends on us doing the things that we know we should be doing, wearing the masks and getting vaccinated to really overcome this Omicron. But cautiously optimistic.
Yeah.
Cautiously optimistic.
Yeah. So, of course, the government just released the N95 mask you talked about a moment ago. As a pharmacist, how will you guys ensure that each citizen that walks through the door gets the 3 masks that they're entitled to?
Oh, we're part of, my pharmacy, we're part of the national program for the vaccine, so we get everything first. So we're just handing them out. We just want you to put on the mask, please, and if you have COVID, thanks for using the drive-through. We're just giving them out. We don't care how many is in your household. If you're walking through the door, we're giving you a pack. We're giving you a
So how many do we get?
I think it's like a pack of three or 4.
So you get a pack of 3 masks as you go to the pharmacy. So did you guys? When did you receive yours? I've lost my mic here.
Our masks?
Yes.
I want to say at the end of last week, maybe.
Okay, so you've got your, and where are you located?
In Fort Worth, we're at Perone Pharmacy.
Okay.
We're independent. We're small, but we got in on the first part of getting the vaccine, so we were like one of the first pharmacies to get the vaccine.
First pharmacy to get the vaccine, and
Retail pharmacy.
one of the first to get the N95 mask.
Yeah.
Okay.
Also, I want to say that, what was I going to say about the, in our community, one of the big things that we need to, it was funny to me when I started it. I work on the west side of town, so that's opposite of the east side of town. It's what you consider the white side of town.
Okay. Is this
People,
Fort Worth?
in Fort Worth.
Okay.
People would literally come to me because they felt like the vaccine was better over there than it was on the east side of town. Now, I can't dispel your myth. I can't say that's not true because, we have a history of getting the bad things or whatever. But it was just amazing how they honestly really thought that. They thought that the bottles that were coming from here was different than the bottles that are coming from there. And that was after I convinced them to get the vaccine at all. Yeah. So now not only do they not want to get it, they don't want to get it in their community because they think that's not the one that they're getting.
But how do we challenge that thinking? Because it's not true.
Send to me.
What do you mean send you?
Like, okay, so Fort Worth ISD had a program. We went to the high schools twice, and we were vaccinating people in the community.
Okay.
They sent me, of course, to Paul Lawrence Dunbar High School, which is my alma mater. And that's a smart move because I've worked in that community before. People know who I am. And when they knew that I was coming, they came to talk to me.
Okay.
Not necessarily getting the vaccine, but I see you talking on Facebook, Gabby, but let me see what's coming out your mouth for real. Or you really,
But let me challenge that because you can't be everywhere.
You're right.
So we do things like this, but you see tonight, we don't have a packed room. So what do we do to overcome that thinking?
Okay.
Because again, we're only at 60% of the population that's vaccinated.
Right. So it's just, it almost has to spread like the vaccine. So I convinced my mom to get the vaccine. My mom is 80 years old. I convinced her to get the vaccine because I said, I know you want to go to church, but when they open those church doors, if you're not vaccinated, you ain't going. She said, okay, I'll get it. My niece didn't want to get it. They did not have a reason. They just, no, why are we doing this? We stand in the house, we're not going to do it. Finally, she decided, okay, I'm going to get it. Then her friend got it. And then it's just like a vaccine. It's just, it's got to come from people that they trust.
Okay.
And it's not just necessarily Gabby, but somebody that has talked to Gabby or that knows Gabby. And then that person talks to somebody, and then that person talks. But that's the only way it's going to be because they're not going to trust the government. They're not going to trust the churches. They're not going to trust the senator. They're not. They're just simply not. So, and some of the healthcare professionals are not on board, so you don't know what what the private physicians are telling them. So it's like the virus. It's just slower than the virus. It just doesn't have the speed of the virus.
Okay. So, Doctor, she raised a very good point, and that's part of what we want to talk about tonight, this whole mistrust factor. I mean, how do we overcome that? Because, Gabby can't be everywhere. You can't be everywhere. I can't be everywhere. And we were instrumental in putting this panel discussion together. We want people that look like us, that, can explain this, people educated in the field such as yourself. But what do we do beyond that to try to really help people to understand that you don't have to go to the other side of town to get the vaccine? It's just as good on your side of town. How do we overcome that thinking?
No, I'm with Gabby on this one. I really think the people who've been vaccinated, and there are enough of us in the community, everybody who was sitting here who told me they've been vaccinated, we have to become the ambassadors of the vaccine. I'm surprised and honestly baffled how often somebody will look at me strange for asking a random person, I'm like, are you vaccinated? Like, it's almost like, like when you meet up with somebody, you're like, oh, how's the weather today? Like, are you vaccinated? It's a great way to start a conversation. And some people may look at you like, what are you talking about? But honestly, we all have to be ambassadors of the vaccine. It cannot begin or stop with me, with Gabby. And frankly, when I come and I talk to people about vaccines, I have all this knowledge. Gabby has all this knowledge. But at the end of the day, it doesn't really matter. It's almost like if you have a headache and you tell me I have a headache, and I'm like, oh, I have some Tylenol in my purse, and I give it to you. It's very rare. I've never had it happen before. Somebody's like, oh, you're a physician. Tell me the mechanism of action of Tylenol, acetaminophen, in fact. How does it actually cause a headache to go away? I could sit there. Maybe Gabby could probably explain it even better than me. It doesn't matter. All that matters is I tell you, oh, you know what? I know a lot of people have taken Tylenol, and it works. It's taken care of my headache many times before. You're like, great, give me that bottle of water. Okay, great. That we have to make vaccines that level of conversation, because right now, 251 million people have gotten at least one dose in this country. 10 billion doses have been given worldwide of COVID vaccines. 10 billion. So anybody who says, oh, I'm just waiting until enough people get it, 10 billion doses have been given out. Like, come on. Like, we have to become the ambassadors. Somebody who's had the vaccine, you have had the vaccine yourself, you survived it. Be the change that you want to see happen. Don't just have them see this, this session on Facebook. You can. I think that maybe we're very convincing up here, but they may trust you talking about it more than even us. And I think the more we do that, it does spread, because you don't want to be the person who's the odd one out in the room. You didn't get vaccinated. And at this stage, I don't want our community. When we go through medical school, you get really tired of hearing all this, like African American, we have the most diabetes, the most heart disease. I honestly got tired of it. And I don't want COVID to be the next thing that's added on, like the next generation of doctors are learning, oh, and then when you look at the different racial and ethnicities in the United States, African Americans had the highest levels of COVID because they chose not to. I mean, come on. Like, at some point we have to say enough is enough. We're not going to be the ones who end up in the hospital. We're not going to be the ones who are dying. Our kids are going to end up going to school like all the other kids. They're not going to be having to stay home because they didn't get vaccinated. They're getting sick. We're going to get ahead of this as well as anybody else. And I'm pretty big believer the shot at is it the west side or the east side?
West side.
It's all the same.
It's all
the same.
The same lot number and everything.
Same on either side. And pull your mic in front of you, if you will. And I want to ask you, because we hear it all the time, maybe on news reports, but you're actually there. You're actually in the healthcare system. You're in the hospitals. What toll or impact has this had on you all as healthcare workers?
Oh, tremendous toll. It's been very difficult. I think at the beginning of the pandemic, a lot of doctors around the world in our community were really scared. Like, everybody was scared. We didn't know what it was like to take care of patients. You didn't know does the N95 mask really work to protect you? I mean, there was a lot of unknowns, and we just didn't know. So a lot of doctors were very scared. There were literally doctors and nurses sleeping in their garages because they didn't want to go into the house and make their kids sick. So, so that was really difficult. And, as infectious disease doctors, everybody was looking at us and we're like, we have no idea what to do because there were no treatments, right? So you call me for a consult. I'm like, I don't know. I mean, we've come up with better drugs now, ways to treat it when people are in the hospital. But as the pandemic has evolved, what's happened is that there's a lot of emotional fatigue at this stage. Yes, there are a lot of doctors and nurses, especially nurses, a lot of huge shortages of nurses because they're the ones who really actually, they're the hands and feet of the hospital. They're the ones who actually give the care. And a lot of them are homesick, but there's also fatigue because it's difficult after all this battle we've been through for 2 years and all these vaccines that have come out and all this information that we have to still have hospitals and ICUs full of people, pregnant women, young people, children in the children's hospital. It was full of kids. It's heartbreaking, and at some point you just start feeling emotionally fatigued after going through that for 2 years. And so we really need to help them out, I think, by supporting them, but also by doing our part.
Yeah. Okay. Same thing for you. I mean, we talk about those who are administering, the care, but as a pharmacist, I mean, you guys are administering vaccines, things of that nature, masks, all those other things that you guys have had to assume these additional responsibilities. What has it been like for you?
The way I see it is that for the past 2 years, when you go to a Waffle House and they cook the sausage and they put that metal plate on top of it, I feel like I've been working under a metal plate because up until December 25th, I hadn't been off. We worked through the entire thing. We did not get off. We didn't have the luxury of, everybody went home, they closed it. Well, they never closed us, because they can't close us, So it's just very hard to, because it does take an emotional toll on everybody. That's why everybody wants to get back to normal, is because they're feeling that anxiety. They're feeling that thing that uneasiness. And we get that you want to get out from under that, but there's some steps that we got to take to get to that point. I think people in the United States don't understand that when it comes to healthcare, we work from a place of privilege because we know that we can walk up into Parkland and they're going to treat us, and we'll worry about the bills later. In some places, there are no Parklands. In other places, you're not going to get treated if you can't pay. But we don't take that into consideration because we've always had that privilege of being able to go and get treated. And so when you have people that take that privilege, I'm not going to mask up, I'm not going to vaccinate, but as soon as I get sick, I'm running to the very place, you don't believe what they say before you get sick, but now, are you going to ask what they're going to put in that IV? Are you going to ask how they're going to put that respirator down your throat? You're not going to ask any of that. But beforehand, you got your Google University degree trying to tell everybody about this or that about the disease. And that's very heartbreaking, especially for the people that are working night and day, keeping people healthy. And you're out here and you're a talking head, and it's like you're working against them. And that's just heartbreaking. And it just adds to the frustration of the entire thing. And it's just that we have to understand that we're all in this together. Everybody has to do their part. Everybody expects the medical community to not break. But guess what? They can break. They're human. Because if that first line of defense breaks, we're in trouble. They are so important, and we take them for granted. That's the honest truth. We take them for granted. We take it that they're always going to be there. But they're just like us. They can get it just like we can.
Yeah. Wow. I was going to ask, as we get ready to land this plane, what's the best advice you could give? But you did your drop the mic moment when you talked about that Google University. So, Doctor, I'm going to come back to you with that. And, Doctor, I want to come to you and ask, what's the best piece of advice you can give to anyone now as we are in this peak, so to speak, with Omicron, but just as we're announced that we're in the peak of Omicron, now we have the stealth Omicron on the horizon. What's your best piece of advice for anyone today, vaccinated or unvaccinated?
I think best piece of advice would be continue holding on to hope. Let's see the future that we want, but be educated about how to get there. Put on your phone literally to the day, you got that little vaccine card saying when you got your last shot, put it to the day of where 5 months are gone for you to get your booster. Don't miss it. And also avoid, I like what Gabby said about Dr. Google. Avoid Dr. Google. Like I have patients who come to me all the time, they're like, doctor, I have a headache, and I have a fever, and I haven't been eating for 2 days. Like, do I have cancer? I'm like, you must have put that in Dr. Google, and that's what they crunched out, Just get the information from the right sources, go to the CDC. They are giving away free tests. Actually, go cdc.gov, free tests, free N95 masks. Continue wearing masks, surgical masks if you have them, N95 masks if you can get them, but any mask, as long as it fits tightly around the face, even if it's a cloth mask, is fine. But let's just hang on and with hope just a little bit longer. I am actually optimistic, and scientists tend to be really pessimistic. So for me to say I'm optimistic, it counts for something, I think, that we are going to get ahead of this. And so let's all be ambassadors for the vaccines and do our part in stopping the spread of this virus, because you don't want to give it to anybody. If it's not yourself, somebody else who may end up in the hospital, maybe even pass from it.
All right. Best piece of advice you'd give?
My best piece of advice is live according to your convictions. If you don't want to get vaccinated, then you should be immune boosting, you should be wearing masks, you should be sanitizing, and you should be social distancing. That's it. And even if you are vaccinated, we should still be doing those things, because as long as there's a viable host that virus can get to, we're not going to be ahead of it. Dr. Thinwa is so optimistic. I'm not. Because people are just taking their personal feelings and fears and putting it ahead of the masses. And that's unfortunate, because it's going to take, we're all in this together, and it's going to take all of us. And I understand some people don't know how to deal with anxiety, and they're just like, well, if I'm going to die, I'm going to take this vacation, or I'm going to this concert, y'all don't got a hand on it anyway, But I don't want that to be the consensus of everybody. I want people that are rational-minded and can think through the fear to listen to people that actually know and live your life according to, okay, I'm going to accept this, and this is how I'm going to live my life, and I'm going to do what needs to be done. Because wearing a mask doesn't kill you. Social distancing does not kill you. Sanitizing does not kill you. Actually, that's something we should be doing anyway. But it's almost like, I hate that at every single step, people are fighting every single thing that they're asked to do. And why? It's just, I just wish people would live according to what they choose. If you don't want to be vaccinated, fine, do the other things. If you're vaccinated, do it all. And I think if we get to that, we can get rid of it. I really, that part I am. But it's just the people that's just fighting it at every step, that's the killer for me.
Well, our thanks to both of you for being here tonight, again, and sharing your expertise and giving of your time to make sure that our community has the information that they need. It's a tremendous help. And we'll continue to do our part. At the Chris Howell Foundation, we're committed to trying to educate and really try and move the needle where we can in terms of folks being vaccinated. But I think one of the ways to get us there is through education, and that's why we did what we did here tonight. So thanks to both of you for availing yourself to be a part of it. Thanks to the audience. Thank you guys so much for being here tonight. You participating. I know we said we're going to do a Q&A, so if there are any burning questions before we completely shut it down, I certainly want to make sure we take those as well. Not any burning questions. You know what that means? Generally, when there are no questions,
that
means
that
you did
we
an astounding
did our
job.
job.
You answered all the questions before they
She
get even asked.
has
Actually, there is a question. Yeah. And what we're going to do real quick, though, let's take this mic.
Sure.
Well, you know what? I'm going to have to figure out a way to get a mic back to you to answer the question. So I don't know. I just do it this way. I'm going to hold the mic in.
Okay. My question maybe is not burning, but I do like the part with the gloves. I hate it when I see people in the store, you have shopped with your gloves on, but you're going to reach in your purse with the same gloves. Right. Get your keys and your credit card to pay for your groceries. That kills me. But my question is, I'm a nurse as well, and I work at one of the major hospitals. Mm-hmm. And I have people that come in that are vaccinated, and it was a no-brainer for me because I would try to convince my family, I'm a nurse, I had to get it for me, for my comfort or what have you. Is it from here, is it from there, did somebody make it up? I don't know, but I know it's going to likely help me because I'm also a world traveler. And when I travel, I have to get all these vaccines I'm not familiar with.
Exactly.
When I go to Africa, girl, you got to get this, that, and the other. When
Okay,
you
so
go
what's your
over
question?
here. So my question is, what do I need to do to continue to convince them? Because you're still hearing that people that have the vaccination, they're still getting sick. I just say, well, the symptoms will be milder. Is there another way to convince my family?
You're nice. I just say, did they die?
Let me let
I
you
mean,
answer as
because
well.
that's what we're trying. The whole point of the vaccine is we can't cure anybody. It's just that we're trying to keep people out of the hospital and keep people from dying. That's it. That's the goal. If they're looking to not get it, we can't help them at this point because we can't stop you from getting it at this point.
Do you want to chime in on that as well?
No, I think Gabby said it really well. I mean, that's really the point. I think it's first addressing that myth that the vaccine's supposed to keep people from catching COVID, and just tell them, have you had a cold before? Yes, everybody has had a cold before. If you get boosted, you get vaccinated and boosted, COVID is really like, at this stage, like a cold. And honestly, that is the case for majority of Americans. I know a lot of people who've been boosted. Thank God, UT Southwestern, a lot of the employees are boosted already. And by far, I don't know anybody who's ended up in the hospital, and most, unless they had immunocompromised or something else,
Right.
did just fine. And so, to me, you have to kind of walk them through that a little bit, and just appeal to the things they already know, that, hey, these cold viruses are always there, but the whole point is we're trying to not die from this, right? And that's what the vaccines do really well. And honestly, at the end of the day, if you tell them you got it, you're doing fine, you work with patients in the hospital, and you haven't been sick, I think that's more convincing.
Mm-hmm.
All right. Is there another question? One more here.
So one of the questions that we get a lot is that getting the vaccine gives you COVID. Is that a true statement or not?
Complete false statement. I think that's something people have had in their brains even from the flu, because I've had a lot of people tell me that from the flu shot too.
Right.
They're like, oh, I never get the flu shot because I remember getting it 10 years ago and I got the flu right after. So it's completely false. And the reason it's false is, and I'll put on a little bit of my science hat here, when they actually make the vaccine, the way they make it, any of the vaccines, whether it's the mRNA, Pfizer, or Moderna ones, it doesn't even have the ability to have the entire virus there. And so all you're getting is the ability to basically make these antibodies, these little soldiers that are in our immune system that help fight viruses, to one little part of the virus. It's like basically they injected you with the ability to make a toe. If like the virus was a human, a toe. Is a toe a human? I don't think so. So it's kind of equivalent to that. So no, you don't get COVID from getting the vaccine. But I think what people are actually getting at is the vaccine works, and it works well. For any of us who've gotten the vaccine, we kind of felt it. I do know some people who are like, I didn't feel anything, nothing happened. For me, especially with the booster, I did have a little bit of fever and chills, and I had some swollen lymph nodes. Like, I felt like I was coming down with something. And I think, and all that is actually the immune system saying, oh, I'm waking up, I'm recognizing I'm supposed to be up and making all this antibodies to fight COVID. So yeah, your immune system waking up does actually make you feel a little sick. So I think that's what people are getting confused by, is the fact that they know somebody, and a lot of people who've had some sort of like maybe a little bit of a fever or sore arm and maybe achiness and that sort of thing from getting the shot. And thinking that's actually COVID. When you actually get COVID,
You'll know.
you'll know it's not like the shot.
Not like the shot at all.
Not like the shot at all. All right. All right. Well, again, thank you guys so much for being here. And again, thank you to the audience. And thank you for those of you who are online. Have a good night.
Thank you.
Thank you.